Hello everybody, welcome to my YouTube channel, Homeopathy Super Sessions by Dr. J.R.Coxe. Today we'll see Alternation of Remedies, number 2 or part 2 of Carol Dunham. This is the first part. Well, Dr. J.R.Coxe article on alternation in the American Homoeopathic Review in 1865 had an unsound argument and incorrect statement. So in the previous videos also, you have seen regarding alteration of remedies, number 1. Dr. Coxe had written his article on alternation of remedies in the American Homoeopathic Review, and he always claimed that alteration of remedies was a good method of prescribing. However, it had an unsound argument and the statement was totally incorrect. Subsequent publications shows that it is not understood in the correct sense as applied to the mode of prescribing homeopathic remedies. So, as we see in the subsequent publications also, the theory of alternation of remedies is not properly understood and it is not applied in the correct sense of homeopathic prescribing. That is on the totality of symptoms. So now let us see point number 1, which Carol Dunham wants us to argue on. The main aim of the physician is to cure the patient. As you all know now, also in aphorism number 1, the main aim of the physician or the mission of the physician is to cure the patient. Nature is not always restricted to a single path. So nature is not always restricted to a single path. That means what? There's not one path of curing the patient or choosing the remedy. You can have many paths in which there are different ways of coming to the simile. It may so happen that in some severe cases, there is more than one way to cure them. That is, there are several ways to cure them. So it may happen also that in different cases, you may get more than one way in order to find out the simile. That means what? One such way is by means of allopathy. As you all know, during Hahnemann's era, there were many different systems of medicine which gained popularity. Each one of them had its own advantages and disadvantages. They lasted for some time and they crumbled after some time. So the allopathy was the most common method of treating the patients during Hahnemann's time, which had disastrous results or it had great side effects. Here there is a misuse of specific remedies. So in allopathy, basically, they use specific remedies to treat specific disorders. Such type of so-called cures, not safe, often have a great debility following the treatment. As you all know that after taking allopathic medicines, the debility is so much or the weakness is so much that the patient gets totally exhausted and the patient's strength is totally drained out. It is also damaging sequel, which is neither rapid nor pleasant. So the sequelae also is quite damaging. So in short, if you take allopathic treatment, the disease may be annihilated, but with the cost of the patient's health. The homeopathists should use the method of alternators often cure the patient. So the homeopaths who use the method of alternation of remedies, they say often cures the patient. These cures are neither rapid nor pleasant as they are not free from the damaging sequelae. So if you use the alternation of remedies, naturally it has a damaging sequel because the cures are not rapid and they're neither also pleasant. The only correct way to cure the sick is to follow the rule of simple single remedy. So the best way to cure the sick is the use of a single simple remedy, which our master, Dr. Hahnemann, has advocated. However, we have to admit that by whatever way the physician cures the patient, he has done the chief part of his duty. So in whatever way he has cured the patient, either by the homeopathic system of medicine or by the allopathic system of medicine, well, the physician has done his duty of curing the patient. Point number 2, from the ethical standpoint, we can conclude that it is better to have erred and cured rather to have never cured at all. So if you see from the ethical standpoint of view, it says that it is better to do some mistake and cure the patient rather than never curing the patient. The physician must beware not to confuse the misfortune of error with that of good luck. So Carol Dunham also tells us that we must remember that the physician must beware not to confuse the misfortune of error. So whatever mistake the physician has done by misfortune or by error, by giving alternation of remedies, and the patient had become all right. Well, that is just because the physician's luck was good, and because of good luck, the patient got cured. And it wasn't because of the physician's dexterity in curing the patient. The physician is a man of science who can be trusted in his active professional life. So Carol Dunham reminds us that the physician is a man of science who can be always trusted in his active professional life. Now the question arises is that, what is it to be a man of science? Well, it is one of those mind is a storehouse of carefully observed facts and is methodically arranged according to the correctly inferred principles of homeopathic science. So who do we call a man of science, or what is it to be called a man of science? Well, it is in the physician's mind. It has a vast storehouse of the carefully observed facts. So whatever cases are there, whatever cases he's treating, all the symptoms are carefully observed and they are stored in the physician's mind in a methodical manner. And then by using inductive and deductive logic, he has arranged these symptoms so that they confer with the principles of homeopathic science, and then he prescribes the correct remedy. Then only we can call him the scientific physician. Thus, the success of a homeopathic doctor will depend upon the nature of his mental process by which he has arrived at the correct remedy. So that is naturally that the success of a homeopathic doctor will depend upon the nature of his mental process, that how the physician thinks logically by using inductive and deductive logic and then deriving or coming at the correct remedy. So the million-dollar question is that a good homeopathic doctor will prescribe the correct remedy. If you prescribe the correct remedy, the patient is cured. If not, you do not get result in practice. So therefore, the practice of homeopathic physician differs from physician to physician because what he perceives in his mind and how he puts the application of his perception into practice will vary from doctor to doctor. Hence, certain doctors are successful and certain doctors are not. The following points can be concluded. So, the following points can be concluded regarding the success of a homeopathic doctor is that either by luck or by accident. So when you prescribe a remedy, it could so happen that just by accident, the symptoms were similar to that of the disease and you have prescribed it, or the luck of the doctor was strong and he was able to prescribe the correct remedy. Or secondly, by using alternation of remedies, example, Bryonia and Sepia. So if you read in this chapter is given an example of a case of Bryonia and Sepia. For angina, to give Belladonna and Mercurius in alternation are recommended by Rummel. So Rummel had advised that in the case of angina, you can alternate Belladonna and Mercurius. But after studying Lachesis, the remedy covered the whole case and the patient is better in 12 months. But if you do a detailed study of the case and if you take into consideration the totality of the symptoms, well, then the remedy Lachesis pops up, and after giving a dose of Lachesis, the angina is completely relieved and the total patient is totally better within a short span of 12 hours, as compared to when Belladonna and Mercurius were given in alterations, and which took a much longer time to effect some positive effect on the patient. Thus, one must be conversant with the sound principles of homeopathy in order to attain success. So actually, you have to, if you want to be successful in practice, you always have to be guided by the cardinal principles of homeopathy. In short, you must refrain from polypharmacy. Fourth point, he must be able to decipher the character symptoms to prescribe. So this is also another very important factor, that the physician must perceive. What in a case? He must perceive those things which are curable in the case. That means he must perceive the symptoms. Which symptoms? The symptoms which are characteristic in nature or symptoms which are PQRS in nature. Because as you all know, to find the correct homeopathic remedy, we have to take into consideration the symptoms which are only characteristics in nature, and common symptoms have to be excluded. Not only that, we have to treat the man as a whole. That means what? Do not only treat the location, the part, or the affected organ, but treat the man as a whole. Because we believe that the whole man is sick and not his part, or not his organ, or not his specific location. And study materia medica with more zeal and enthusiasm. And always be a lover of materia medica, refer different books, see according to the case which remedy fits the patient very well, study from different books, confirm and reconfirm, and then only give the remedy. So basically, what are we doing? You are doing nothing but you are individualizing the case. So as you all know, individualization also is the essence of homeopathy. So if you want to read an example of Colocynth, you can read page 169 to 170, in which Carol Dunham has given an example of Colocynth. Another example of cyclamen and dysmenorrhoea has also been given. You can read it in details, page 170 to 171. Thus, when we apply inductive logic, we become successful in practice. Why? Because inductive logic deals with the facts. So whatever facts are there, whatever symptoms are there the patient is presenting, that we have to take and that we have to apply in our practice successfully. The London Homeopathy Review, volume 9, page 432, quotes Dr. Halley's words. He says that you have to see the facts and not theories. You have to look and see. We see that in one case, Dr. Halley gives Bryonia and Sepia in alternation, and in another case, he gives arsenic and china. Here, both the cases are cured, much to his satisfaction. But when Dr. Halley looks at the same fact, he finds that alteration remedies is better than the use of a single remedy. So this is his opinion. The London Review also sees the same fact that cases can be cured only by such alternations. So even the London Review agrees to that cases can be only cured by alternations. It is a broad generalization on a very narrow base. So basically, you're generalizing it too much and the base is too narrow. To conclude, the physicians who always use alternation of remedies have never bothered to treat man as a whole, in which he yields promptly to a single remedy. So therefore, if you use alternation of remedies, you have never bothered to take into consideration the man as a whole or the full totality of the symptoms. But you are just taking two remedies which probably fit the totality. One remedy fits one part, second remedy fits another part. So in combination, both the remedies fit the exact totality. Thus, alternations are blind empirical way of treating the patient. So if you advocate this method, it is a blind method in which you are shooting an arrow in the dark. If it hits the bullseye, you have cured the patient. If not, the patient is not cured. So it is an empirical and a blind method of treating the patient. So that's all for this part. In part 1, part 2 will be coming soon. Please do stay tuned for more. Thank you very much.